We talked about apneas, brady's, and DSATs, or A's, B's, and D's, in a previous module and how they're normal throughout your baby's NICU stay. You may be wondering, what else will happen? Why does my baby need to be in the NICU, and when can they leave? It can be helpful to understand how the NICU helps your baby. So, let's discuss.
Your baby's job in the NICU is to grow. Growth is measured in weight, length, and head size. Your baby's growth will be plotted on a growth chart and is expected to follow a curve. Your team is keeping track of these details, and you can ask for an update whenever you'd like. The most important thing to remember is that growth is not linear. As with many things in the NICU, your emotions and expectations, growth can be like a roller coaster. The NICU tends to focus on growth over time. It's important to remember this if and when you're feeling disappointed or anxious that your baby lost 10 grams. In a few days, they may gain all of that back plus some.
Generally, expect your baby to be discharged close to their expected due date if they were born early. Of course, your baby may be there for more or less time, but this is a good rule of thumb to keep in mind to manage your expectations. Remember that your baby's journey is unique, and try your best not to compare their progress to that of other babies.
While your baby's in the NICU, you may catch yourself comparing how they look to other babies. The most visible comparison to spot across babies of different gestational ages is their size. Younger preemies are smaller and have less body fat, and therefore they need help to stay warm. Think back to a time when you're freezing cold, teeth chattering, and body shivering to try to warm up. This burns calories, and your baby should expend as little energy as possible. The isolette regulates your baby's body temperature so they can use all of their energy to eat and to grow. Over time, as your baby gains weight, your nurse will slowly lower the temperature of the isolette until they can finally turn it off. It's such a big milestone when your baby can move from their isolette to a crib or a bassinet. Be sure to remember how much work your baby has done to get there, and keep this in mind when you're filling out your baby diary.
Your baby needs to be in the NICU so your nurse can monitor their vital signs. Generally, your baby's heart rate will be between 120 to 200 beats per minute. Their breathing rate should be 40 to 60 breaths per minute. Their oxygen saturation should be between 95 to 100%. There are reasons why your baby's vital signs may be outside of these ranges, like if they have a heart condition or they're receiving oxygen. Prematurity can contribute to heart defects. Based on their vital signs, presence of a heart murmur, or other risk factors, your baby may be screened with an echocardiogram or echo, which is an ultrasound of their heart. There's no pain or radiation with an echo.
The brain and central nervous system controls many vital bodily functions. Neurologically, a preemie's brain has not finished developing. The earlier your baby was born, the higher their risk of A's, B's, and D's. As your baby grows and their brain matures, these episodes tend to decrease. You may see your nurse stimulate or literally wake your baby up to help them come out of an episode. Other times, your baby may come out of an episode on their own. Your NICU team may also decide to give your baby daily caffeine. Just like your morning cup of coffee can make your brain sharper and your heart race, preemies receive their own version of an iced coffee. Caffeine helps stimulate your baby's brain to prevent apneas and encourage normal breathing, among other benefits.
Your baby's brain also controls how they eat. Eating is easy for you and me. We don't even have to think about it. For example, you can talk on the phone while stuffing popcorn in your mouth while also catching up on your favorite Netflix show. However, eating is complex for your NICU baby. Babies need to coordinate sucking, swallowing, and breathing all together. This is why your baby may suck and swallow amazingly from the bottle, but have trouble remembering to breathe while doing so, which leads to DSATs. Try not to be discouraged. Think of this as practice for your baby. Everything is a skill that can and will be learned. The suck, swallow, and breathe reflex generally kicks in between 32 to 36 weeks gestational age, So, if your baby was born at 28 weeks, expect their first bottle to be at 4 to 8 weeks old. If the age thing sounds confusing, check out our NICU follow-up video in the last module for further explanation. If your baby is on respiratory support like CPAP or is intubated, then their first bottle may come a little later. Please ask your NICU team if you have specific questions about when your baby will be ready to take their first bottle. Before your baby is ready to take a bottle or breast or chest feed, your baby will get their calories and nutrition in other ways. It's okay to feel grief over this unexpected change and how you hope to bond with and feed your baby.
At first, nutrition can be given through an IV directly into their belly button and then later through a vein in their arm or their leg, or even one directly into their heart called a PICC line. Through the IV, your baby receives protein, fats, carbohydrates, vitamins, and minerals for complete nutrition. This IV solution is called TPN, which stands for Total Parenteral Nutrition. Your baby's TPN is tailored specifically for your baby based on recent blood tests and their growth. Your baby may also receive an extra dose of fat in the form of IV lipids.
Since it takes a while for the suck, swallow, and breathe reflex to kick in, your baby will likely start eating through a tube called an NG or OG tube. This is a thin, flexible tube from their nose or mouth that goes directly into the stomach, bypassing the need to coordinate a suck and swallow. This sounds scary, but babies tolerate them very well.
Feeding your baby in the NICU is a really important topic that we discuss on its own in a separate module. In the feeding module, we discuss bottle feeding, breast and chest feeding, pumping, positioning your baby, and other important information. Your baby's lungs may also be affected by prematurity. A common diagnosis in the NICU is respiratory distress syndrome, or RDS, since the lungs are one of the last organs to fully develop. The lungs produce a substance called surfactant, which helps the lungs expand and contract more easily, but surfactant is not in good supply in preemies. Fortunately, there are ways to help your baby's lungs develop before and after delivery. Before delivery, your OB may have given you steroids if an early delivery was anticipated to help your baby's lungs mature. After delivery, an artificial form of surfactant can be given to your baby. Your baby may need additional help to breathe, and this can come from a form of a nasal cannula, CPAP, a breathing tube, a tracheostomy, or a ventilator. As your baby shows signs of improvement on respiratory support, the NICU team will gradually decrease the amount of support that your baby needs until they can breathe on their own. It's really hard to estimate how long your baby will need one type of respiratory support over another, and it's normal to feel frustrated if your baby isn't progressing as fast as you're expecting.
A breathing device such as CPAP or a breathing tube on your baby's face is yet another thing attached to them. While there may be limitations with how you can hold and care for your baby as a result, there's usually a way your nurse, like Amanda, can help with positioning so you and your baby are both comfortable.
Preemies are also at a higher risk of infection since their immune systems are underdeveloped. This is why the NICU is so obsessed with hand hygiene. Your baby's care team is always watching for signs of infection. Clues can be very subtle, from a higher heart or breathing rate, an increase in the amount of DSATs, or if your baby just looks off. This is why you are so important and considered a vital member of the care team. Nobody knows your baby better than you do. You should always bring up any concerns that you may have, even if it's just a gut feeling.
Preemies are also at risk of anemia and jaundice. Regular blood tests are used to monitor anemia, and there are ways to correct for this, either with medications or blood transfusions. Jaundice is treated with those blue lights known as phototherapy.
Your baby's eyes may also need special attention. Retinopathy of prematurity is an eye disorder caused by abnormal growth of the blood vessels in the retina, and it typically affects preemies born before 31 weeks gestation. A pediatric ophthalmologist may follow your baby both in and after their NICU stay.
To sum it up, Your baby's care team will monitor many aspects of your baby's growth and development. Tests may be done, including blood tests, ultrasound, MRIs, swallow studies, x-rays, and eye exams. Your baby's care team also provides treatments, including medications, breathing therapies, and occupational and physical therapies. Your physical presence and care for your baby is an equally important part of the equation.
Let's refer to the baby diary to find ways tangibly that you can reflect on your baby's progress so far.